Very much. Now, this is my first time as a rapporteur, so apparently some people do amazing things with visual art, and I'm going to apologise up front and say I have not done that. But what we have tried to do is just summarise, as Evelyn said, some of the key themes. There's been some really interesting discussions, so we won't be able to kind of touch on everything, but hopefully this will just give you a nice recap of the day. I do just want to again thank our medical students, so Mithalin, Ali, 2 Emmas, Chris and Samuel, who've helped with the summarising for us, because I couldn't have done it without you, especially with half an hour after the last talk and all the discussions. So we started off the morning with this fantastic introduction from Pippa Halings, who's the MP for South Cambridgeshire. And Pippa talked about her long-standing sort of commitment to global health through both education and also advocacy, and really struck the tone for this importance of thinking about health and climate and the impacts of climate change on health. And she also talked about some things that came up throughout the day, things like community-level approaches to challenges, thinking about seeing ourselves as leaders and not just as people that are going to teach, but also bi-directional learning, and also the impacts of both physical and mental health, and things like the access to healthcare with damage to infrastructure through climate change. And so that was kind of setting the scene for the day. And so what I wanted to do now was just summarise each of the themes and the talks. And then what I'll do is kind of wrap it up with what I think are the cross-cultural themes that have come across throughout the whole day. So this morning, if you think way back, we had research in global health as our sort of first set of talks. So we had a fantastic talk from Professor Whiffin on the community engagement work that's been going on in our acquired brain and spinal injury research group. And she talked a lot about the importance of building relationships and community engagement being driven by the people that the research is meant to be improving the health of. We then moved on to an example of a global research project and looking at trauma as a sort of way of looking at health systems throughout the world. And Mike talked to us a little bit about the challenges, particularly in areas with conflict, in terms of access to data, in terms of collecting high-quality data. And obviously, we've just heard all the really fantastic discussion about conflict in health and how that is a real challenge that I don't think any of us can ignore anymore. We then moved on to talking about some of the safe surgical initiatives, so the Lifebox initiative, looking at strengthening surgical safety through both antimicrobial resistance and also looking at surgical site infections in more general in both Ethiopia and Rwanda. And again, lots of discussion in the panel about these important sort of cross-cutting themes. So antimicrobial resistance is a problem for everybody, and using bi-directional learning to really use things that perhaps we can learn from different cultures. So then we moved on to education in global health. And we had a lot of really interesting talks. So we had a perspective from a medical student looking at how we can actually have impactful medical education and thinking about this concept of bi-directional learning that starts right from medical student electives. We talked a lot about innovative training solutions, the use of mobile technologies in health, some of the challenges of using mobile technologies, and also the effects of workforce migration. And again, that came back again later on, the effects of climate change, the effects of conflict on our workforce migration, and also about the importance of using education as a way of retaining our medical workforce. Panel discussion really did focus on our medical student electives, and obviously there's been a lot of work in Cambridge that we've heard about today about how we try and make our electives bi-directional and how we make sure that they are ethical electives so that there is actual reciprocal learning across the two. And again, further discussions on the cost implications of mobile health, on the challenges of mobile health, including things like linking training to performance and how we make sure we have access in those hard-to-reach areas. So things like using SMS versus using smartphones, for example. Finally, I'm going backwards. So finally, we then had our session that we've just completed on clinical practice in global health. And I think we covered an awful lot of really interesting topics at the end. So Dr. Thin talked about the health workforce challenges, and again, this concept of healthcare in conflict is a growing challenge. Healthcare workers are having to work in the midst of being attacked directly or infrastructure attacks, which then disrupt the healthcare system. And we heard some examples of how telehealth can be used to try and deliver care to populations that otherwise don't have access. We then heard about using sustainable models of improvement, so a partnership with Kakamega in Cambridge, utilising the IHI quality improvement methodologies, and how we need to be flexible in working across those different contextual areas. And finally, we heard from Ben about how the NHS can learn from lower middle income countries. So some fantastic examples like the Westminster Council adopting a model that's come from Brazil. And I think that's for me, a really powerful example of how we really mean it when we say bi-directional learning. And also a theme that came throughout the day about how we need to approach health as a system. We can't look at just in silos at different aspects. So I've created a bit of a word cloud. I'm not going to sort of talk through it, but this is just some of the things that came up through the things we've been talking about. And I wanted to pick out from that some of the themes that kind of cut across all of the talks today. So I think we can't ignore, first of all, the concept that climate and health are interlinked. And we cannot ignore either aspect of them. And as healthcare workers and as people involved in global health, we really have to be thinking about the impacts of climate change and how that's going to affect all of us as we go forward. And lots of fantastic work that's being done using technology to make a more sustainable and environmentally friendly way of running our partnerships. We heard a lot about the role of communities, and that's something I'm really passionate about in my research, but we heard about different ways in which our communities are really involved in healthcare. So that's community engagement at a formal level, but also thinking about how we build things from the ground up and not relying on governments or policies to direct everything, but taking those communities and helping them to shape the work that we do. We heard a lot about workforce. It's a growing problem, and we heard a lot about the impacts of either migration or, for example, in Malawi, how training medical students to become the future doctors is really challenging, but also how some of the ways we can try and address that. Again, conflict comes back here. Conflict is, and the climate, climate disasters are two ways in which we lose really large numbers of healthcare workers. So again, it's about thinking about how we can maintain our health workforce, how we can train them, how we can retain them, and how we can keep them safe to deliver healthcare amongst all these other challenges. A theme we can't ignore is technology. There's some fantastic examples of good technology. I had an attempt to do an AI picture of one of the things, and it was a bit of a disaster. It did not come up with anything sensible, so I didn't include it. But I thought I'd have a go. But technology is fantastic, and people are doing some really innovative things to look at all aspects from training to direct clinical care, and also thinking about research. Finally, infrastructure is a theme that's come up throughout the day, be that infrastructure as a result of climate change or conflict, or infrastructure as a result of funding. So we can't train medical students if we don't have the spaces to teach them. And if we don't have the space to teach them, we're not going to be able to increase our workforce. And I think that cuts across everything. Also thinking about access to things like electricity and water. In extremes of climate, do we have places where people can stay cool? And are our governments sort of building that infrastructure so that we can deliver that healthcare? Finally, I can't end this without talking about systems, just really, really briefly. So healthcare systems are so important, and viewing all of these things together, I think, is probably the take-home message for me from today, is that we need education, but we need research. We need a workforce that is motivated to stay, that we empower to stay and deliver healthcare for people in our local communities. And I think that's just as important here as it is anywhere. We need to look after our workforce in the UK if we want to keep a motivated workforce, and we want to do that around the globe. So I think that's the main things I've taken out from today. I'm very happy if anyone's got something they think I've forgotten to open that up to the floor, but otherwise I'll stop there.